Welcome, I'm Dr. Vadim Maitas. I'm the bariatric surgeon here at the medical group at Montefiore St. Luke's Cornwall Metabolic and Bariatric Surgery program. Here at Montefiore St. Luke's Cornwall, we are a program that is built on quality. Since 2017, we have been accredited by the national body for our excellent outcomes and patient satisfaction scores. We are a comprehensive weight loss program, meaning we specialize in surgery as well as medical weight loss management. Choosing to do bariatric surgery can be a complicated and difficult decision for a lot of patients. However, some of the advantages of bariatric surgery include resolutions of high blood pressure, heart disease, diabetes, sleep apnea, as well as increase their quality of life and decrease their mortality. One of the most common questions is who actually qualifies for surgery. In our program, it is anybody over the age of 18, anybody with a BMI or body mass index greater than 40, or BMI 35 or higher with one other comorbidity such as diabetes, high blood pressure, or sleep apnea. We will now go over what I call the ticket to surgery, or the pre-surgical checklist, which needs to be completed by every patient that wants to go through with surgery. The first part is monthly appointments. Every patient, depending on insurance, will need to have at least 3 to, on average, 7 monthly appointments with the program. The appointments that count towards this are with the surgeon or with the nutritionist. At the first appointment, we will also be ordering blood work, which is another insurance requirement. Blood work can be done here on site on the same day to make it easy and seamless. As I mentioned before, a minimum of 2 nutrition appointments are necessary for every insurance prior to authorization for surgery. Our team will help to coordinate and set up those appointments for you to make this as easy as possible. Another insurance requirement is a psychological evaluation. This is required by all insurance companies. For most, a licensed clinical social worker can do the psychological evaluation. However, there are a few instances where insurances require this to be done by a psychiatrist or an MD or DO. We will help you set those appointments up as well. The next part of the surgical checklist is a letter of medical necessity. Once again, in most occasions, this can be done by our office here. However, there are a few instances where this will be required to be done by your primary care doctor. We will advise you on how to proceed. The next few items on the checklist will not apply to every single patient, and this will be decided on your initial visit. The first one of these is a sleep apnea evaluation. This will be reserved for higher risk patients or if it is required by your insurance. We are a 100% nicotine-free program here. If patients are coming in that are using nicotine, whether smoking, vaping, or chewing tobacco, we will help set them up in order to quit. Each patient will sign a contract stating that they understand that they will be nicotine-free a minimum of 8 weeks prior to surgery. We're going to encourage that all of our patients are up to date on their age-appropriate cancer screenings. This means if you are due for a PAP or a mammo or need to have a colonoscopy, this will be encouraged that this is done prior to surgery. Medical clearance will be one of the last few things that is completed on the patient's checklist. This has to be done within 30 days of scheduled surgery, so there's no need to rush to do this right away. Endoscopy is something that needs to be done in every patient prior to surgery. If somebody had it done within the past year, that will suffice. If not, we will schedule that either with myself or if you have your own GI doctor, that it will be fine as well. The last part of the pre-surgical checklist will be cardiology clearance. Once again, this will not be needed for most patients, only ones that are higher risk or have a history of heart disease. Bariatric support group information will be provided to each patient. Currently, we have them monthly, and each patient is encouraged to attend at least 2 prior to scheduling surgery. Lastly, our program is a patient-centered approach. We fully understand how hard it can be to make the initial appointment. The goal of our program is to provide support and motivation with every step of the way before and after surgery. Making the initial appointment to discuss weight loss can be the hardest part of the journey for patients. We'll be here every step of the way, and we look forward to seeing you in person. To make an appointment or refer a patient, please contact us at 845-534-7080, option number 4.